Hello everybody, my name is Jesus Tejeda and today I'll be teaching you about bulimia nervosa, how this eating disorder is present in athletes and how coaches and team members can provide support to help the person with eating disorders. Is bulimia nervosa. It is an eating disorder in which the person has regular episodes of eating a large amount of food, during which they feel a loss of control over eating. The person then uses various ways such as vomiting or taking laxatives, trying to get rid of extra calories in an unhealthy way. Psychological and behavioral characters of an athlete with bulimia nervosa. Unbalanced serotonin and nephrine levels can result in both mood disorders and abnormal appetite irregulation, being eating, fear of being discovered by another athlete or family member, depression, which includes low self-esteem and lack of feeling control, diets that is unnecessary for appearance, health, or sport performance, evidence of vomiting unrelated to illness, excessive exercise beyond the requirement for an athletic sports, excessive use of restrooms, self-critical, especially concerning body weight and sport performance, substance abuse, and the overuse of laxatives during both that are not permitted or prescribed by a physician. Long-term effect of eating disorders on an athlete. The long-term impact of eating disorders behavior on an athlete can be several, as their energy output requires proper nourishment and optimal body functions, both are which are impaired by the eating disorders. The following consequence can occur long-term if an athlete is not treated for this disorder at eating behaviors. Metabolic imbalance, increased risk of an athletic injury, poor sports performance, decreased training response, decreased coordination, impaired aerobic functioning, damage some vital organs, loss of menstruation cycle, infertility issues are present in females, increased risk of heart disease and cardiovascular complications, bone and muscle loss, ulcers, gastrointestinal complications, tooth gum disease, and even tooth loss, increased depression and anxiety, increased risk of substance abuse, increased suicidal thoughts, and even death. What are the athletes with the most effect on bulimia nervosa? Young male and female athletes tend to be at a great risk of having eating disorders if they play in sports that focus on personal performance, appearance, diet, and weight requirements, such as competitive sports includes swimming and diving, bodybuilding, wrestling, gymnastics, running, dancing, beach volleyball, figure skating, and rowing are some of the sports where most of the students present bulimia nervosa. As I mentioned before, some main factors that contribute to bulimia nervosa are anxiety, depression, and performance in sports. For athletes, the message that a lean body correlates to improved performance seems to be one of the driving forces that might start an athlete on a cycle of losing weight. One comment by the coach that an athlete needs to lose weight can start an athlete on a dangerous path, which include the following examples. Weight restriction either by sport or by the coach. That includes gaining weight or losing weight. Judging criteria that emphasize thin and stereotypically attractive body builds. This relates to the pressure that exists among other athletes to have a toned and slim body. Therefore, athletes might apply pressure to themselves to reduce weight for either appearance or performance. And lastly, coaches apply pressure to lose weight, either by stop eating or either by increasing the competition level or the exercises. Tips for coaching preventing eating disorders in athletes. Promote proper nutrition practice. Focus on fitness, not body weight. Be sensitive to weight issues. Promote health management of weight. Teach mental skills. Provide educational around prevention and recognition of eating disorders, particularly to staff and coaches. Provide education around prevention and recognition of eating disorders. Make appropriate treatment recommendations for athletes who are suspect of having an illness. Work with treatment team professionals to set clear expectations around necessary recovery patterns to resume or maintain athletes' participation. Be a part of the solution rather than part of the problem.